Joint pain, it's one of those things that can start small, but it can quickly change, well, everything. Today, we're going to break down all the crucial info on joint pain and arthritis, pulling from the expertise at the Westminster Clinic to really map out a path from diagnosis all the way to recovery. So let's dive in.
Just think about this for a second. Is joint pain making simple, everyday things tough? We're talking about walking up the stairs, opening a jar, or even just getting out of bed in the morning. When those little moments start to hurt, it can really change your entire life. So, how do you know when that little ache or bit of stiffness is, something more? Let's talk about the specific signals your body sends out that are basically screaming, hey, it's time to get this checked out.
Right, so what are we looking for? This isn't about a minor tweak that's gone in a day or two. We're talking about pain that just hangs around for weeks. Or visible stuff, like swelling and redness. And, oh yeah, that classic morning stiffness that makes getting your day started a real chore. Basically, if it's getting in the way of your life, that's a sign. And this brings us to something that is just so important. You can't just tough it out and ignore these signs. Getting a professional to take a look early on can make a huge difference. It can literally slow the whole thing down and help you stay mobile for years to come. All right, so let's say you're recognizing some of those signs. The next step is to understand what you might be up against. I mean, what is arthritis, really? Let's get a handle on it. At its very core, it's all about one word: inflammation. You can almost think of it like a tiny, slow-burning fire inside your joints. And that fire is what's causing all those problems: the stiffness, the swelling, and that frustrating feeling of not being able to move like you used to. Now, it's super important to know that arthritis is a big umbrella term, not just one single thing. There are lots of forms, but these three are the ones you'll hear about most. You've got osteoarthritis, that's the classic wear and tear. Then there's rheumatoid arthritis, which is totally different. That's when your own immune system starts attacking your joints. And then there's post-traumatic arthritis, which can pop up years after an injury. So this leads to a question I hear all the time. Isn't this just something that happens when you get old? And the answer is a definite no. That's a huge misconception. Like we just saw, things like rheumatoid arthritis or arthritis from an old sports injury can absolutely affect people in their 20s, 30s, and 40s. It is not just an older person's problem. Okay, so you go to a specialist. How in the world do they figure out what's really going on in there? This is the diagnostic phase, and it's all about creating a super precise map of your specific condition. It's actually a really clear, logical process. It all starts with a conversation. You just talk, tell your story, what you're feeling. Then they take a look inside, using tools like X-rays or MRIs to get a literal picture of your joint. And finally, they put all those puzzle pieces together, what you said and what they see, to figure out exactly what's up. So once that clear diagnosis is in hand, everything shifts to treatment. And listen, this isn't a one-size-fits-all deal. Think of it more like a big toolkit where the specialist picks the exact right tools just for you. This quote really just says it all, doesn't it? The magic word here is tailored. Your journey is unique, which means your treatment plan has to be unique too. It's about blending different approaches to get the best possible result for you. Usually the first line of attack is what we call conservative. That just means non-surgical. This can be stuff like medication to cool down that inflammation, or targeted injections that put relief right where it needs to go. And, of course, physical therapy, which is huge. It's all about building up the muscles around the joint to give it more support and stability. But what happens when those things just aren't cutting it anymore? When the pain is still there and you're still not moving the way you want to? Well, that's the point where the conversation might start shifting toward more advanced options. When we talk about surgery, you can kind of think of it in two big buckets. There are minimally invasive procedures like arthroscopy. That's like a tune-up where they can go in and clean things up. And then you have joint replacement. That's the big one for when arthritis is really advanced and they replace the whole damaged joint with a new one. Okay, we've talked diagnosis, we've talked treatment. Now let's get to the best part, the path back to moving freely. This is all about recovery and getting your quality of life back. So here's a tangible number for you. After a big procedure like a joint replacement, you're typically looking at about 6 to 12 weeks to really get your function back. But notice that last word there, rehabilitation. That is key. The physical therapy you do after the surgery is just as important as the surgery itself.
And really, this is the main takeaway from all of this. A diagnosis of joint pain or arthritis does not have to be a life sentence. It doesn't have to be what limits you. With the right care and the right plan, you really can get your mobility and your comfort back.
So I'll just leave you with this question. What would you do? If you could move freely again, without pain, what's the first thing you would do? Go for a hike, play with your kids, just get through a day feeling good. That's the goal. That's what this is all about.